Walking to the kitchen, walking to get your laundry, getting coffee, it all counts. A new study shows that walking, no matter where or for how long, is beneficial. Joining me right now, Dr. Raj, a pulmonary critical care and sleep specialist. A study published in the JAMA Internal Medicine Journal this week shows that walking lowers the risk of early death. How many steps do we need to take, Dr. Raj?
You know, in a perfect world, I wish we all could take 7,000 to 10,000 steps, but it's not feasible to everyone. And I think the take-home message from this journal is that every single step counts. Don't live that sedentary lifestyle. And you know what, everyone? Walking helps almost every organ in the body. And I definitely want to talk about, the big killer. What affects us? Heart disease, the #1 killer in the United States for both men and women. And what are those risk factors? High blood pressure, type 2 diabetes, high cholesterol, your weight. And you know what walking addresses? Kind of all those. Individual studies have shown that walking, getting those extra steps decreases your blood pressure, a huge risk factor. Losing that weight will help out control your blood sugars if you're a type 2 diabetic, lower that cholesterol. And you know what? Those risk factors I just talked about for the heart kind of goes for stroke. So you're getting a 2-for-1 over there. But I want to make sure I throw something in there. I'm a lung doctor, and for all my patients who have asthma, COPD, pulmonary fibrosis, take those steps. Meaning that, what's better than just taking medications, opening up the lungs, getting outside, helping yourself mentally and physically. So, this research that's been published really adds to the wealth of knowledge that we know that exercise, walking is important.
And obviously, people do take the time to walk, maybe walk here on Lake Michigan, walk to the dry cleaner just to save them the money on gas. But the studies show that the health benefits are especially important for people who do unstructured physical activity like housework, gardening, and dog walks. Is that because it's better to do these walks when we're in a relaxed state?
Oh, I like where you're going with this. I just think that it's now encouraging that, hey, there's a moderate intensity you want to get, sure, but let's get walking for everyone. What do I love about walking is that for most people, you don't need to train for it. You just go out and do it. You don't need to buy expensive equipment. It reminds me of just my mom, after a meal, what does she do? She always walks around the house. Maybe it helps out with the heartburn, which is a good idea. And, being in the hospital, if I could just take those extra steps instead of taking the elevator, every little thing counts. But you're right. When we talk about walking, it relaxes you both mentally and physically. And, what you do during the day definitely helps you at night to get you some good sleep.
All right. Dr. Raj Dasgupta, thank you so much for being with us. And I know that I love walking. Nick and Gerard, do you guys
That's your
enjoy
thing.
it?
You do it every day.
I do it almost every day.
It's good for your mental health, too. And even if I'm walking to and from the fridge, I like that.
That's good. We'll do that right now.